Well, I'll probably defer some to my clinical colleagues next to me here on both sides of me who are probably better prepared to answer that. But, and with the governor's just announcing today, I think that as July 1st, that he's going to potentially end the mask mandate for Minnesota, or earlier if we hit 70% of the population being vaccinated. My goal as the CEO of a healthcare organization, we have to live to different standards, and as an organization who is probably has a higher potential for exposure by having positive COVID patients in our environment, we'll likely be masking at different time frames and different levels than the public might be advised by CDC. So we'll look to Minnesota Department of Health and the guidance from our clinical partners to gauge that. But I suspect that masks won't be going away too soon in healthcare organizations to some level. So, any other?
I would agree with you, Mike. When you look at, we have to protect our patients, right, from us. So that we deal with typically immunocompromised. I mean, many people are. So in our interactions with them, we will be extra cautious. So I would imagine that MDH, that's our guidance, Minnesota Department of Health, we would have to follow their lead when they make changes for healthcare workers.
It's interesting that we get a lot of questions as physicians from our nursing staff particularly. Are we going to have to wear masks forever?
Yeah.
And honestly, we don't know. We're hoping not to. And again, that magic herd immunity time frame, if we get there, we can maybe shed some of these masks. There's clearly a mask fatigue and a COVID fatigue out there in the general population, as well as in the medical industry. So.